the World Federation has been working on designing a branded web page and portal, which is now live and will serve as a hub for scientific exchange, collaboration, and networking between members of the global vascular community. And we have established new bylaws to reflect the current structure of the World Federation. Furthermore, I've had multiple discussions with council representatives across the globe at all of the varying societies, and I've tried to identify common concerns or themes that they would like to address. As such, we've narrowed this down, and the focus is first, training and education. We're working on developing access for a virtual educational program like the Society for Vascular Surgery has already developed. And we're going to be exploring different training paradigms which can help teach vascular specialists on a global scale. We're hoping to try to connect like societies such as the Association of Program Directors in Vascular Surgery and explore whether or not there are other societies in the world that we can connect with to try to identify where we can help augment training in those locations. Ultimately, we'll leverage digital strategies such as simulation or virtual learning, and we've been exploring that lately with different companies to try to see what's really available and might be reasonable. We'll try to increase access, especially in those countries that are underserved. And we'd like to really get ultimately all vascular surgeons to a minimum level of training. The other program we'd like to look into is that of limb preservation. Amputation is a crisis worldwide. Diabetes is also a big problem, and it contributes to limb loss. So we'd like to look into educational mechanisms regarding best practices for open and endovascular therapies to address limb loss and prevent that, different revascularization methods for chronic limb-threatening ischemia, and education regarding best medical management of peripheral arterial disease. We also would like to consider the impact of COVID-19 and its impact on training as well as management of these patients with this problem. And a third key focus will be thromboembolism management, particularly deep vein thrombosis and pulmonary embolism. Our goal ultimately was initially we united with the European Society for Vascular Surgery to provide financial support from the SVS and European Society to help reinvent the World Federation to the digital platform. And in doing so, it gives us access to the educational platform that the SVS just recently launched, which has been a wonderful contribution on their part to vascular education. We plan to allow the World Federation membership to have access to this educational platform, and then we can reach out to our council members at the different societies, and then they can reach out to their societies and give the contact links to their members so they can enter into this portal and learn the things that they maybe don't get exposed to or they don't have enough exposure to on a day-to-day basis that they just want a refresher. Furthermore, they can also use this for their trainees. And we do know that there are certain countries around the world that just don't have enough vascular surgeons. I know there's really a shortage, for example, in South Africa, where our colleagues there are working hard at, for example, preventing limb loss related to diabetes, foot problems. And they stated that they need to use many other people, such as nurse practitioners, allied health extenders, as well as podiatrists to try to work together and collaborate. So we think that we can help allocate some of these resources to these types of groups so they can review this on the website and hopefully improve management of the patients in their region. We are also looking into, is there a way that we can provide some simulation or virtual hands-on management or care? What we'd like to do is to reach out to the different quality initiatives, for example, the Clinical Practice Project or the Vascular Registry Project of the Society for Vascular Surgery, or the COVID-19 Collaborative started by Dr. Max Waller, or even the International Consortium of Vascular Registries, which is a combination of the VascuNet and VQI efforts, to see how we can help disseminate the work that they've done and reach farther out into the globe and expand the knowledge base where our reach where we can reach. We have the World Federation Connect web-based platform, and that will allow for professional exchange of ideas, and that will be ongoing, and we'll continue to work on that. There are global guidelines being developed for diabetic foot management. Now, that will be a several-year project, so we'll certainly help with that whenever we can. And I think ultimately in long-term plans, we'd like to be able to have the options for a World Federation mentorship. I know right now our colleagues in Australia are trying to help those vascular specialists from different small islands across the Caribbean, for example, learn more techniques. So they're looking for not only a web-based platform for education, but they also want a hands-on, and perhaps we can be a connector for those countries that need more maybe on-site training and those that are able to offer that to them.